Okay. Hi, my name is Elizabeth Pride, and I am presenting to you some education about neonatal abstinence syndrome. Now, most of you are labor and delivery nurses, so I'm going to come at this from a point from labor and delivery, not necessarily from the neonatal side. Neonatal abstinence syndrome is a syndrome that happens to the babies who are whose mothers are drug addicted. They might be addicted to marijuana, cocaine, methadone. You guys have seen plenty of this. But this is what happens to the babies afterwards. They actually have to be hospitalized for quite a while. And so the idea behind this project is to stop the problem before it starts. And as you all know, we have a lot of repeat offenders. We have women who come in labor, have a baby, who has this abstinence syndrome, and then comes in a year later and has another one. So what we want to do is educate them a little bit better on the process and what happens. So there's the first thing that I want to talk about is the fact that these women, I know that a lot of us can be a little judgmental towards them because they do come out, a lot of them are strung out, and they don't really understand what's going on anyway. So it's really easy to say, to judge them. However, some of the contributing factors to drug use among these women are poverty, a lack of education, a lot of abuse sexually, physically, and emotionally, violent victimization in childhood and adulthood, familial influences. If their mother has done it, their grandmother has done it, their husband does it, their boyfriend does it, most likely they're gonna be users also. Psychosocial imbalances and non-controlled prescription drug use. Some of these women have had a previous accident and they've started on opiates and they can't come off of them. We recently had a mother in the unit who had been on Vicodin for 2 years. And then she tried to come off of it when she found out she was pregnant, and so she was on methadone. And I don't think a lot of these mothers understand that methadone is just as addicting as the Vicodin is to the baby. And then also non-tapering of the methadone. We had another mother who came in who had been on between 40 and 60 milligrams of methadone for 2 years and had not been tapered at all. Methadone is one of those drugs that as long as they're down to 20 milligrams, you won't see a lot of you won't see it in the baby. You won't see like withdrawal symptoms in the baby if they're below 20. Most of them are not below 20 though. So if we can come at this from the mother's standpoint, now a lot of these mothers have been in some kind of program. So if we can talk to the program manager that they're in and complement what they're already doing with them, we can really make a difference in their lives. Also, with these people, their word of mouth is a huge deal. So if we can get to them, we can get to their friends, we can get to their sisters. We can let them know that there's a way to get beyond this. One of the places here in Louisville that takes care of pregnant women who are addicted is JDEC has a project called Project Link. The contact is Maggie Schroeder. I spoke with her for over an hour. She's very committed to this program, and she was telling me a little bit about it. They are specific to drug addicted pregnant women. It's more of a case management program where they come in and they are referred. They can be referred or they can come in on their own. But they take them to their OB appointments. CPS is involved. They try to get their family members involved. The program is free, and even if their house is full, they will always find a bed for a pregnant woman to get care. So they provide resources for food and clothing for the mothers and for the newborns. And then one of the houses that they will refer to is called Freedom House, and it's run by the Volunteers of America, and they are much the same type. They do a 3 to 6 months residential inpatient, and they will keep the mother for 6 weeks after giving birth. So these are some of the programs that are available in Louisville. Maggie Schroeder, who is part of Project Blink, has offered to come in and speak with the nurses and to tell us how we can actually complement their program and what kind of education we can give on our side to these women to stop what they're doing before it happens and before it starts again. One of the other things that we have issues with here in the hospital is that once we get their babies, we don't see a lot of parents, and that was something that I always struggle with, is the fact that we are withdrawing their babies from these drugs and they don't come in. Well, Maggie explained to me that a lot of times after giving birth, they go straight back to the house and they quickly withdraw them. So they take them off of everything as fast as they possibly can. So they're going through some serious withdrawals at the same time as the babies are, which I did not know this. So a lot of times that's the reason why we don't see them, is because they are withdrawing at the same time as the baby is. CPS, of course, is usually involved, and they will follow them through postpartum, and will get them into a place where they can learn child care, they can get resources for their baby, and get themselves off of drugs, and they also follow them through the first part of their life. They can get them into school, they can find them a job. So the program itself is very good, and it's well run. It's just not well known. That's the biggest problem. Also, one of the big problems in Louisville is that there's not a lot of places for these people to go. And I know that most of you have seen that some of the new specials that they are doing at University of Louisville and here at our hospital. We are having an overrun of neonatal abstinence syndrome babies, which means that we have an overrun of pregnant women who are using. So basically, my idea here is that we can get to these women, and yes, they've already done it, they're here in labor, but if we can get to them and help them to see that there are resources that can help them, and to give them just a chance, and to give them some understanding and let them know that we can help them. Education is super important for these women. We need to talk to them about the risk factors relating to both them and the baby. And I've included a handout sheet for all of you, and it goes over some of the, I won't go over all of them right now, but it goes over some of the bigger drugs that we see coming in here: marijuana, heroin, methadone, alcohol. Obviously, we see a lot of that. And what I have here is the maternal effects and the fetal effects. This is actually a handout that can be given to the mothers, and it tells, it's very plain language that they can understand as well, but it tells like what this drug is actually doing to their body, and then it tells the drug the effects that it's actually having on the baby, and what the baby will be like after they give birth to the baby, what kind of withdrawal that they're going to go through. How long it's going to last, what kind of drugs they have to take, and basically how painful it is for them as well. So giving them this kind of information, I'm hoping will sway their choices and make them not be what we have seen so often. That's people coming back in numerous times with the same problem. So education is the key, and that's what I have here. Is that it's so important to not to judge them, but just to continue to educate them. Some of the things that I read some interviews from women who have given birth, and one of the biggest things that impressed them the most was the nurses who took care of them and the doctors who took care of them were candid and open, talked about their drug problem, did not say, didn't give them a judgmental attitude. They just were very open about it. They didn't, hide behind anything. They just said, okay, you're on methadone. How often are you taking it? How long have you been taking it? When was your last cocaine hit? When was your last marijuana joint? What is it that you took? Just so that we can help you. So being open and honest with them will open the doors to educate them also. The goal for this program is to complete their pregnancy to term and have a safe delivery of the infant, and to provide a basic understanding of newborn care. Some of the factors to review is what exactly the woman was exposed to in pregnancy, and to let them know that, of course, the baby is exposed also. The amount of exposure depends on 3 factors, and that's the ability of the substance to pass through the placenta, They need to know this, which, again, this is on the paper that we can hand out to them, is what passes through the placenta and how much of it is ingested by the baby. And we also need to know how often the substance was taken. So some of the information points to give to them is to let them know that, most of us don't know until, 6 to 8 weeks far along if we're pregnant or not, because, and of course some people know earlier, but even at the point from 4 to 6 weeks, the teratogenic effects that can happen to the fetus, a lot of times early in pregnancy is what can cause the most harm. So letting them know that is very important. A lot of the drugs that they are using can cause a stop in menstruation, which a lot of them, they get pregnant and they're very far along before they even realize that they're pregnant because of this. So the reason why this is so important here is because Kentucky is actually in the national eye of neonatal abstinence because of the rise that we've been having. The Kentucky statistics for hospitalization of newborns addicted to drugs has risen from 29 in 2000 to 730 last year. So, it's a huge rise and it's a big problem. It's not just a big problem in Kentucky, it's also a big problem nationwide. Among pregnant women ages 15 to 44, there's been a 5% that were currently addicted to illicit drugs, which is a very large number. And it has gone up significantly in the last couple of years. One of the reasons why is because over-the-counter drugs have been so easy to get a hold of. That is actually getting ready to stop. There are some laws that are being put in place that they're making hopeful to make these harder to get a hold of. The last thing I'd like to give you is there is a conference that's going to happen on March the 14th and 15th, and it's here in Louisville. It's at the Olmsted. It's for substance-exposed pregnancies. It says understanding the impact on mothers, infants, and caregivers. And this program is going to be chock full of the newest and latest and greatest information, legislative updates, the CASPR information. CASPR is the legislation that's coming into effect. It's a list of people who have gotten out narcotics and who have gotten opiates from pharmacies. And if you're on this list so many times, that your name comes up and they question it. So this is one way that they're trying to control the market on these. Prenatal drug screening, OB care for addicted mothers, the Finnegan NAS scoring tool, which is something that we use in the NICU to score these babies. The long-term outcomes of the NAS infant. All of this is going to be educational tools that we can use to help these women. So I hope this has helped, and I hope this we can get the education out there. As nurses, it's so important that we educate our clients, and this obviously is a clientele that needs more education, just because we're getting here in Kentucky, especially, we're getting such a rise of this kind of clientele. So, does anybody have any questions before I close?
Whose responsibility is it to taper the methadone?
The place that they get the methadone from. For instance, Freedom House does not administer the methadone. Maggie Schroeder told me that a lot of times it's the women's primary care physician who gives them the methadone. It's their responsibility to taper it.
Is that why no one's tapering? Because they're just passing it off?
They're passing it off, yes. That's what it sounds like to me. But I think that if everyone who is involved in this woman's life will notice that she's on the methadone, know what the tapering protocol should be, we can get these women off of the methadone, which, I understand the importance of the methadone. It gets them off of the harder stuff. But even when they're pregnant, they need to come off of it, or at least get down to 20 milligrams a day, so that we don't see the effects on the infant like we're seeing. So, again, I'm giving this information to your manager, Maggie Schroeder. She is, I've got her phone number here and her address, and she is more than willing to come in and give some education and talk. Like I said, she was very passionate about her job, and she gave me some really, really helpful and useful information. eye-opening. So, and I've also got these handouts for you. This has got all of the education points that we need to give to these mothers, kind of how to teach them, along with a list of the drugs and the maternal effects and fetal effects. And I've also got a brochure for that conference that's going to be in March. So, any other questions? Okay, thank you for your time. I appreciate it.
Thank you.